Colonial Health Center is a 48-bed skilled nursing facility owned by Genesis Healthcare Centers. It is located at 2365 Nashville Road in Bowling Green, Kentucky. Colonial Health Center is certified by Medicare and Medicaid and has been providing services in the area for over 40 years. When arriving at the facility, we couldn't help but notice the intimate atmosphere of the resident common area. There was no designer-looking couches and armchairs, but instead, homey-looking furniture lined the walls. After Bingocize, residents would fill the common area, waiting for the Price is Right to come on. The staff were always nearby and available to assist in any way. Bingocize is a program that incorporates the familiar game of bingo and short, repetitive exercises into one activity. Bingocize was created to engage the older population in more exercise in order to increase their quality of life, engagement, and overall health. The Assistant Communication Coordinator for the Bingocize research team, who is responsible for corresponding with the participating certified nursing facilities to aid in data collection and program site support, said this about the Bingocize program. Individuals living in certified nursing facilities need to maintain a certain level of physical activity and social engagement to live a long, healthy life. The Bingocize program meets both of these objectives by combining the fun and social game of bingo with the beneficial exercises that support range of motion, strength, balance, and more. The participants of Bingocize at the Colonial Center are older adults with a range of capabilities. There are 10 to 15 participants at each Bingocize session at the Colonial Center, most of them being regular participants of the activity. These individuals require different levels of aid throughout Bingocize, ranging from needing no help to needing maximum assistance placing their bingo chips or completing the exercises. At Colonial Health, we use laminated large black print on white paper. The high contrast works well with the residents, especially those with vision problems. The residents use either blue or orange chips. They are slightly elevated, which allows them to be easily grasped by those with motor impairments. Some of the physical therapy equipment we use includes Bingocize exercise balls. Throughout the exercises, residents use the balls to work their hands and arm muscles. Exercise bands are also used to work the upper body. One modification that has been made is tying the band off so that they're slightly shorter when used. This allows residents with limited movement to still participate and work their muscles. The bingo call cards are white with large black print on them. These cards allow residents to have visual feedback to help in case of any sort of auditory discrepancy. Pictured here is one resident utilizing the easy-to-handle chips to cover her card. Here is a picture of a different resident squeezing his exercise ball between his hands. This exercise helps with fine motor skills. This resident has just won a prize after getting a bingo. The nursing home keeps the prizes. The prizes include sugar-free candies, pretzels, sodas, mints, lotions, and shampoos, among other things. The residents are able to participate in a fun activity while also working their bodies. These exercises allow muscles to be worked that may not be used on an everyday basis. At the Colonial Center, we have worked together as a team to make Bingocize a memorable experience for all these participants. Once we arrive at the center, the CNA who works there begins to bring the residents to the activity room. A lot of times when we arrive, some of the residents may just be waking up. Therefore, it takes a few minutes for them to make it to the room. While we are waiting, we fix the room up for Bingocize and work to minimize all distractions. Over the semester, we've noticed our number of participants growing, which makes us very excited. At the beginning, we would have around 8 residents, but now we have close to 15 residents participating. Many of the same residents come every week, but almost every week we have had a new face. We love to see and get to know the residents each week. Since we have such a variety of residents, we have also had to make a few accommodations to make each resident's Bingocize experience the best that it can be. All of the students have worked together and have come up with a few accommodations. One accommodation includes having a student at both ends of the table calling the numbers. We quickly learned that many of the residents may be hard of hearing and need to be closer to the person calling the numbers out. By having 2 students call the number, it allows all players to be able to hear what's being called and eliminates unnecessary confusion. Another accommodation we have implemented includes prompting the individuals if they are unable to find the number on their card that has been called. We often use hand-over-hand prompts, modeling, and pointing. This allows the resident to still be the one playing, but it lets them have a little help if needed. Some challenges we've noticed at the facility include limited space, distractions of other people, and the windows. However, we've worked hard to eliminate these distractions to our best ability. When we can hear people talking in the other room or there's something occurring outside, we can direct the residents back to the game or the exercises, and oftentimes they're able to continue just fine. At the Colonial Center, we have both communication sciences and disorder students and exercise science students. By participating in Bingocize, we've had the opportunity to work together and learn from one another. The exercise science student participating in Bingocize said that he has learned many ways to improve and better his communication with this population, given he had no previous experience. While the communication sciences and disorder students said that they have learned the importance of simplifying exercises and how important it is to adapt an exercise to a specific resident. For example, when you ask a resident to raise their arms in the air and they may not understand or be compliant, whereas if you say, pick an apple from a tree, you'll have better results. At the beginning of Bingocize, we had trouble when it came to eliciting participation in the exercises. We quickly came to realize that the most effective way of getting them to do or try the exercises was to make it sound relatable to something they had done before, like a daily activity. Among some of the more popular exercises were swimming. The Bingocizers will relate to this because they had done this before, and along with swimming was apple picking, squeezing orange juice, kneading dough, waving to your neighbor, and reaching to scratch your back. These exercises focused on mobility and flexibility of all the upper body joints. We also used the bands and the stress balls to integrate some strength and resistance training to our program. We would do single hand ball squeezes, 2 hand ball squeezes, and 3 different angles of band pull-aparts. All of these exercises and stretches are designed to increase strength and mobility to Bingocizers, and this will make the activities of daily living easier for them. To achieve our objectives, we all made sure to give a visual example of us doing the exercises together. Some of us would show the adapted way to perform the exercise, while the others would perform the exercises if they had no physical limitations. These made the Bingocizers more confident, and it made them want to try because they saw how easily we were doing it. We noticed that a few residents began to participate more and more, and then more residents would join in as well. We also made sure to be loud and clear with our instructions so everybody could be on the same page with what exercise was next. Our assessment of choice was the hand grip strength test. This was performed by having the Bingocizers squeeze the hand dynamometer in each hand with max effort and then recorded the numbers off of the instrument. We chose this test because most of our participants weren't able to do any assessment that involved getting out of their wheelchair. This was also a good choice of test for us because the hand grip strength is highly associated with morbidity and mortality. The percentile rank on the right side of our chart shows what class for hand grip the strength participants fit into. The lower the rank, the higher the chance of morbidity or mortality. The higher the rank, the lower the chance of morbidity or mortality. When working with the geriatric population, it is important to consider their hearing loss as a natural part of aging. It's also important to consider their ability to communicate with us verbally because this can be impaired by neurological changes to the individual due to causes of stroke, TBI, and dementia, just to name a few. At Colonial Center, many participants in Bingocize had some degree of hearing loss. To aid in helping them better understand what we were saying, we tried to minimize any background noise. We spoke a little louder, and when we spoke to them, it was face-to-face on their level. Erasing all background noise is nearly impossible, but there are a few things we did to help. We turned off the TV, closed the windows to the kitchen, and we were all quiet as the individual called out bingo cards. Our participants that were not able to produce speech as clearly or concisely as others were still able to communicate with us throughout Bingocize. We became accustomed to many individuals' routines, such as taking their medications during Bingocize or getting their coffee. With this knowledge, it helped us to interpret what the participants were communicating to us. When other participants that were still hard to understand were there, we would get face-to-face with them and on their level, and this improved our ability to understand what they were trying to say to us. By reading their facial expressions and other nonverbal signs, we were also able to better understand their communicational intent. At the end of our time at Colonial Health Center, we had the wonderful privilege of interviewing 2 of our regular participants. Our friends Ron and Mildred have become very dear to our hearts.
So why don't you tell everybody your name and how long you've been at Colonial?
Ron Nagel, over here.
Over here? Got it. And now, Ron, we see your smiling face all the time at Bingocize. You're always smiling, and I just want to know, is it a real smile? Do you really love Bingocize?
Yes.
Yes. What do you love most about it?
The exercise and the bingo.
The exercise and
Well,
the bingo. After going through the program for a few months, Would you keep participating in Bingocize?
Yes.
You would do it again?
Yes.
Would you recommend to a friend?
Yes, really.
Yes, really.
We don't get much exercise here except Mondays when we get the arthritis people here. And it's great to get some exercise.
Why don't you tell the people your name and how long you've been here at Colonial?
My name is Mildred Mooneyham, and I've been here for about 4 years.
4 years. And Miss Mildred is one of our regulars here at Bingocize. So, Miss Mildred, can you tell us what you like best about Bingocize?
I like it all.
You like it all?
Yeah.
Do you have a favorite exercise that we do? No? Just any
I'm
of them?
trying to get I've got a bad knee here. I'm still trying.
You still trying with a bad knee. Well, would you like to continue doing Bingocize?
That's up to everybody else.
It's up to everybody else. But if it were up to you, if you had the final say,
I would have the exercise because I think we need it.
We found that Bingocize is a great opportunity to gain more experience with the older population and to learn how they interact with visitors as well as with each other. One of our students mentioned that they wanted to work with children from the get-go. She reported that this experience allowed her to broaden her horizons and work with a population that she had not previously worked with. We were also given the opportunity to work with those that we had not had the opportunity to work with before. We were able to gain some empathy and learn more about their abilities in this process. During Bingocize, we were able to meet and work with people from all kinds of backgrounds, which was a very interesting experience. Our adults were so much fun. They joked and helped and encouraged each other throughout our sessions. The individuals at Colonial Health Center have a broad range of personalities, which made each Bingocize session unique and interesting. Working with the older population is a very rewarding experience that most all of us wish that we had been able to have before now. Bingocize is a great way for all the participants to engage with each other, strengthen their bodies, and maintain or improve their health.